Welcome, everyone. My name is Sean McMahon, and I am the Program Manager for the Lister Hill Center for Health Policy. I'm very excited to welcome you to today's webinar, Vaccine Uptake in Low and Middle Income Countries. Today, we will explore vaccine hesitancy in LMICs. Today's webinar is made possible by the Office of Public Health Practice, the Public Health Student Association, the Sparkman Center for Global Health, and the Lister Hill Center for Health Policy. Each of these sponsors is offering interesting and informative virtual events all semester long. Check out their websites and social media for updates. Today we will be learning from Ms. Lois Privor-Dumm. Lois is the Senior Advisor for Policy, Advocacy, and Communications, and the Director for Adult Vaccines at the International Vaccine Access Center, which is housed in the Johns Hopkins Bloomberg School of Public Health. She is an expert on equitable vaccination and access across the life course. Her research covers determinants of vaccine policy decisions and uptake. She works in underserved communities and partners with local faith leaders to guide conversations about trust in government and institutions to co-create solutions that increase trust and acceptance of vaccination and the systems that support them. Currently, she is focused on COVID-19 vaccine rollout in Baltimore City and Maryland in vaccine hesitant populations. Globally, she works with the World Health Organization and partners to advocate for vaccination and the Immunization Agenda 2030. She joined Hopkins in 2005 and has worked in more than 70 countries, helping to accelerate vaccine access. She holds a Master's of International Business Studies from the University of South Carolina and executive certificates in Human-Centered Design and Innovation and Business Communication from Johns Hopkins Carey School of Business, and with that, I will turn it over to you, Lois.
So it's such a pleasure to be here to speak to what is a very important topic on people's minds. Hesitancy is important no matter where you are in the world. And globally, 2 to 3 million people or children die per year from diseases that are vaccine preventable. So we do need to ensure that we're increasing vaccine coverage. In 2019, Dr. Tedros, the Director General of the WHO, added hesitancy to the list of the top 10 global health threats. So I'm happy to be here to talk to you about where we are and what we need to do to ensure that we're not leaving anybody behind. So for today's agenda, what we're looking at is, I'll talk a little bit about the context and the Immunization Agenda 2030, just to ground our conversation in the way that the global community is thinking. Then we'll talk about understanding vaccine uptake in low and middle income countries, vaccine hesitancy, and next steps. So first, I wanted to start with the Immunization Agenda 2030 and the vision, which is where everyone everywhere receives the benefits of vaccines for good health and well-being. There's a number of different goals that are articulated in this agenda, including reducing mortality and morbidity against vaccine preventable diseases and leaving no one behind. The third goal is particularly important, not only for all people, but also hesitant individuals, because we not only want to ensure that we're providing immunization services, but also want to ensure that we're providing services that enable them to achieve good health and well-being through primary healthcare systems. So starting with where we are today and vaccine coverage, we've come a long way since the 1980s, when we started at just about 20% immunization coverage. Today, we're about close to 9 in 10 children receive their first dose of DTP or diphtheria, tetanus, and pertussis containing vaccines all over the world. So that's the good news. The other news that we need to consider is that there's a number of different disparities depending on where you live in the world. And in some cases, vaccine coverage is actually declining. And we look at 3 doses of DTP, as we consider that as an indicator of whether children are receiving vaccines at all or not. If you'll notice here, there's some places like the Americas region where vaccine coverage has actually declined. In other places like Africa, they're struggling to bring their coverage up. There's some good news in Southeast Asia, where some of the larger countries, including India and Bangladesh and others, have improved vaccination coverage and access over the year, but there's still a lot to go. And if you look at what's happening right now with COVID-19, this tells a completely different story and talks about some of the challenges that we're going to be facing going forward in keeping routine immunization up. So what the graph here shows is from a pulse survey, which is a survey of all of the various countries around the world, asking whether their routine immunization has been disrupted in any way. So in the green, those are the countries that have said we've had no disruption. So that since COVID-19, and that's really good news. But what is more concerning are all of the proportion of yellow bars and the number of countries that have experienced disruption in fixed post-immunization. So in other words, people are coming to a clinic to get their children vaccinated. Now that's the cornerstone of routine immunization. So ensuring that these services are still there are not only important for immunization, but it's important for overall health. Going into this a little bit deeper, what we're really concerned about are children that are not vaccinated to begin with. And this is prior to COVID-19. So, well, the coverage estimates are coming in during COVID-19, but prior to COVID-19, we still saw about 14 million infants that lack access to vaccines at all. And about 6 million of those don't get their third dose of DTP. So they may get that first dose and not come back, meaning that if they need other types of services, they're probably not getting those services as well. And it's those unvaccinated children that we're really concerned about. The green bars do represent those 0-dose children, which may be that they received their first dose of DTP or didn't receive any DTP at all, which we refer to as 0-dose children. So there's a number of reasons why children are not receiving the vaccines. And this is important when we're talking about vaccine hesitancy, because sometimes we think that it's because they don't want to get their vaccines, when in fact, reasons for not receiving vaccinations are both on the supply side as well as the demand side. So on the supply side, part of the problem is in lower middle income countries, even getting access to certain vaccines can be problematic. So it may be that there's newer vaccines coming out, vaccines like HPV vaccines, where countries really do have a desire to introduce those vaccines, but there's not enough supply available. Or it may be down at the clinic level where a parent comes into a vaccine clinic and finds that, the doses just weren't delivered. They may be getting to the country, they may not be getting to the country at all, but getting them there is a problem, and there is no vaccine to be able to be immunized. We're seeing that, of course, now with COVID-19 vaccination. But for routine immunizations, this is a real problem, because if there is no vaccine, the mother that's bringing her child in to get vaccinated may not come back. Cost and financing of vaccines is also a barrier. So this again can occur both at the family level, where cost is a barrier, and it may be that they're not paying anything for the vaccine itself, but have to pay transportation costs to be able to get the vaccines, or have some other costs that they're incurring to be able to get their children vaccinated. And then at a country level, those financing concerns are a real challenge for many countries. Perceived low burden, again, has a number of different levels. So it could be at the individual level that prevents the individual from getting a vaccine. For instance, if you're not seeing a particular disease, you may not be motivated to get a vaccine. At the provider level, again, that's also an issue. And at the country level, it's an even bigger issue because oftentimes there's poor data about different diseases. So it will depend on the particular vaccine and whether they're gathering enough data to be able to say that this particular disease is a problem. I'm going to skip over for a second the vaccine and safety and efficacy concerns and come back to that in a moment. But programmatic challenges are also a concern. And this has to do with everything from logistics of being able to get vaccines to where they need to be and at the right point in time, to whether the vaccine clinics are actually open and convenient for people to be able to get vaccines, to whether the treatment that somebody gets when they go to a clinic to get a vaccine, whether that's at a minimum level and whether the parent perceives that there's quality in those clinics to be able to get vaccinated. Going back to some of the things that we find often affect demand are things like vaccine safety and efficacy. These aren't the only things that affect demand, but people have their perceptions, and that does impact whether somebody will go and get a vaccine. And we'll talk in a lot more detail about that. And on top of that, there is an infodemic. I don't know if you've heard that terminology before, but this is when we're talking about there's a lot of information out there, and sometimes that information just is not correct. And it's really tough to be able to weed through what should I believe, what should I not believe, what is a good source of information. And being able to get ahead of that is really crucial to building confidence in vaccine programs. So let me talk about vaccine hesitancy before I go into the rest of the talk, because I think this is an important concept that we often, when we think of vaccine hesitancy, we're thinking about the people that refuse vaccines, or over on the left-hand side of this chart. You have people that refuse all vaccines. We often call them anti-vaxxers, people that are really dug in and completely against vaccines, and may also try and convince others that they should be against vaccines. But then as you go towards the right-hand side of this graphic, the continuum changes, and that's where the majority of people are. That they may be unsure, they may have some concerns, but it's not about all vaccines. And most people, for the most part, in low and middle income countries are really they accept vaccines. So we do have to remember that people can be hesitant, they can have questions about vaccines, but the majority of people ultimately do accept. And remembering that vaccine hesitancy is a continuum is a really important concept. So when the World Health Organization started looking at vaccine hesitancy, they put together, there was a strategic advisory group of experts, or SAGE group, on vaccine hesitancy. And they started identifying the drivers, like what are the causes of vaccine hesitancy in that broader sense. So we're not necessarily talking just about the people that refuse vaccines, but the people that have questions and may ultimately go on to get the vaccine. So those three drivers included something that we call the 3 C's, which is confidence, convenience, and complacency. So confidence are things like, is the government forcing us to do something that we don't want to do? Are they doing it for reasons why they, just want to give money to the pharmaceutical companies? Or, are they approving this too quickly? So all of these things have relationships to confidence or vaccine trust. From the convenience standpoint, we need to think about when you actually go to where you get vaccinated, is there supply? And can I get there easily? So is it something that is in my area that, I don't have to go to great lengths to be able to access? And then complacency is something that we see that people just don't see the need necessarily to take a vaccines. And some examples are that amongst younger people in particular, not having seen disease, they may have a low perceived risk of that particular disease and may not even want the vaccine. Later on, there was a model that looked at the 5 C's. So there were 2 other aspects that were included in this, which includes calculation, which is the weighing of the benefits versus the risk. So people can have fears about the vaccine. And the example that I would use right now, a great example is COVID-19, where this is a very new vaccine and people don't know whether it will have some type of safety effects. So you can go through a process that says, I'm really concerned about disease, and I'm really concerned about the risks of the vaccine, but the risk of the disease far, far outweighs the risk of any safety effects that I'll have with the vaccine. The other is collective responsibility. And people have different perspectives on this particular concept. In some cases, the idea of we're doing this to protect not only ourselves, but to protect others really resonates. There are some countries in the world in particular, or some communities in the world, that where they look at vaccination not only as their responsibility to to protect themselves individually, but a responsibility to protect others that are more vulnerable, that maybe can't receive the vaccine. And all of this is grounded in a behavioral model, because ultimately we want to increase vaccination. So this is a model that's used by WHO called Increasing Vaccination Model, very simple. And ultimately, they look to what motivates people to be ready and willing and to get the vaccine, or what motivates people to be hesitant. So things like what people think or feel. Oftentimes you hear about attitudes and perception studies. These are done to really understand what is going into whether people are ready to have the vaccine or not ready to have the vaccine. The other aspect that becomes really important is what happens in their community and society. So in other words, is their doctor recommending a vaccine? Is it the thing that you do? Like, are all the other mothers around giving vaccines to children? Or did your parents always encourage vaccination? So those are things that are social norms. The other processes that are going on that are particularly challenging to deal with is the way that information is passed around. And in the current context of new levels of digital communication, this becomes even more challenging. Now, beyond motivation, there's also the practical issues that we need to talk about. And those were the things that I mentioned before is the vaccine actually available? Can I get there? Is there any incentive to get the vaccine? Or, am I just done with vaccines? So this last point about intervention fatigue is a really important one, because think about it. People have been talking about COVID-19 for quite a while and vaccinations for quite a while. And sometimes when people are hesitant, it's almost as though they just don't want to hear anymore and shut down. So that's another challenge that we really do need to make sure that we're dealing with to ensure that we get to that final box, which is vaccination. So the next question is, how confident are people when it comes to vaccines, particularly in low and middle income countries? So what we see is generally, and this is a study that was done by the Wellcome Trust in 2018. So it was pre-pandemic, and I'll talk a little bit post-pandemic in a minute. But what we generally see that is that confidence in lower income countries is still fairly high, but there are pockets that we need to be concerned about. So this was a question. So on the left-hand side, you'll see perceived safety of vaccines. So this is that vaccines, do you agree or disagree that vaccines are safe? And then on the right-hand side, it says, do you agree or disagree that vaccines are effective? And what you see is, like, particularly if you go to Africa, the second and third, fourth, fifth bar down, that you see higher degrees of agreement than some of the other countries that you might see in Europe, for example. So, but there are areas of concern, like in particular Central Africa, some of the countries that have had to deal with Ebola that have higher degrees of hesitancy. So one of the things that we find is that opinions about vaccines are nowhere near the point that you can generalize in any particular country or any particular region that there are no problems. There are concerns just about everywhere you go, but maintaining a good eye on what is happening in a country becomes particularly important. And as I mentioned earlier, COVID-19 adds a completely different perspective to hesitancy. So this is a survey that looked at 15 different countries and what was happening in Africa. What we saw is that most Africans in the survey said that they would receive the vaccine. So it was nearly 80% that said that they would receive a COVID-19 vaccine. And there were some countries that had very, very high acceptance, and some countries that had much lower acceptance. And looking into that a little bit further, for those that didn't want a vaccine, and this is important to understand, what is actually going on, because remembering that scale of hesitancy that we talked about earlier, even if people do go and take the vaccine, it doesn't mean that they don't have some of these concerns. So it becomes really important from a communication perspective to understand what the fears are or concerns are about vaccines. And generally what we're seeing are concerns about whether these vaccines are safe. There's some other things that are going on, like there's a group of skeptics out there that don't even believe that the disease exists. That is something that you don't need to answer every single question, and sometimes it's better to just leave it unaddressed, because the more you bring things up, the more you'll make a problem when there wasn't a problem there. But for things like safety, that's something that you want to communicate about and give clear and transparent answers. Now, so looking around a different poll, and this is a geo poll for COVID-19, it suggests that there is uncertainty versus routine immunization for children. So remember the Welcome study, we saw that acceptance of vaccines was very high. But then when you go to COVID-19, if you look at all of these different countries, there's pockets of concern there. And then again, you can see where the concern is that about safety and efficacy, consistent with what we saw before. Certain countries are really concerned about safety and efficacy. And if you look over at the top right-hand corner, take a look at DRC, which is at 34% of the people agree that the vaccines are safe, and 40% believe that they're effective. So that's relatively low, and something that would be concerning, and something that you would want to make sure that you answer. So there's additional barriers for COVID-19, and this is an example based on a study in sub-Saharan Africa. And the thing is, when we're considering barriers, we have to consider barriers at the public level, the health system level, and the provider level. So there's other things going on besides hesitancy that we need to be concerned about, or the concerns that for the public. We're going to have to, understand some of the challenges that for routine immunization are also going to be challenges for COVID-19. So for instance, if you have a lack of awareness, that may be a little bit better for COVID-19, but it may not. Literacy is an issue. The fears that people have are probably going to carry through. But then again, when we're thinking about what is going to affect a COVID-19 vaccine, there are some things that are somewhat unique that you also have to add on top of that. And those include, like, most countries don't have vaccination systems for adults. And it's not normal for an adult to go and get their vaccines. They may believe that vaccines are for children, or there's a lot of misinformation. So there's a lot of things going on. And then from the health system question, dealing with confusion about, how do we ensure that we get the right amount of vaccines to the right place? Why were these allocations done the way that they were? And do we even have registries and know where to find people? We register children, but do we register adults? And then at the provider level, making sure that they know how to handle it, that they know how to communicate it, or that they might have some of the uncertainties about vaccine that the public have, because again, this is a really new vaccine coming really quick. So addressing hesitancy has to happen at two levels. One is addressing the emergency at hand. We have to communicate out there and communicate quickly. But there's a slower process that needs to happen at the same time, which is continuing to maintain confidence and trust in the system. So this is working both ends at the same time and ensuring that we're getting the vaccine out to the people we need and the specific needs, but also recognizing that vaccines are part of a bigger healthcare strategy. So what's needed to build vaccine acceptance? So a number of different groups, including WHO and UNICEF, the International Federation of Red Cross and Red Crescent, and others, have put together a global risk communication plan and a community engagement strategy. And these are important to think about because COVID-19 is a platform for building acceptance of vaccines more broadly. And some of the things that they identify is making sure that whatever you do, that it is community-led. And when dealing with vaccine hesitancy, hesitancy is actually a very local issue. And the issues may be specific to particular communities, so that's important. Looking at data and understanding where disparities are occurring is also important in developing your hesitancy strategy, because going back to those zero-dose children, knowing the communities where people just aren't being vaccinated to begin with helps you determine, is it because they have attitudes that they don't want vaccines, or maybe there's other types of barriers that need to be addressed. We want to make sure that we're building capacity within communities and that we're being collaborative. So the other thing that we need to consider is the amount of disinformation out there. And what we see is that disinformation can start in one place, and in this case, it was news in Australia that quickly makes it through Asia and all through Africa. So keeping in mind that information is never just local. It seems to move very quickly, and having the capacity to track information and disinformation in particular becomes really crucial. And just so you know, when I use the term disinformation, I'm referring to that as something that is intentional. So misinformation is something that, there's wrong information out there all the time, but usually it's not intentionally wrong. Disinformation is spreading rumors. So there is a vaccine misinformation, which also handles disinformation. But I wanted to make you aware of a very useful guide that just came out recently. It's called the Vaccine Misinformation Management Guide. And it was put together by a number of different partners, including UNICEF and Yale. And it has some very helpful charts here, because before we start dealing with misinformation and disinformation, it's important to also consider, how much of a risk is this? So there's different levels of risk and different responses that you might take depending on whether something is high risk or low risk. So some of the different choices that you make is that, like, for instance, if there is, if something is just out there and, going to a small number of people, there's probably not a whole lot that you need to do to be able to, address those particular issues. So that's something that you might be able to ignore, or you might be able to what's called pre-bunk. And this is, just providing enough information out there that goes along with the facts to essentially inoculate people against misinformation. So they've already heard that there are some rumors out there, and that you want to ensure that you're providing them with the good information and providing them with facts. So this guide is something that I would recommend to look at, to think about, how do you approach misinformation and disinformation? But I want to talk about the longer term, which is building trust. And that's something that is, no matter where you are in the world, it's something that becomes really important to think about, and helps make communities resilient. So it may be that you have a problem at hand that you have to deal with right now, or you may want to engage communities just to ensure that that trust is there. But either way, it takes time. It involves the community and the people that are trusted messengers within the community, and make sure that there's good information out there, because people will go anywhere to get information. And usually they go to the internet because that might be the easiest thing to do. Or maybe they're hearing a rumor from their neighbor or somebody in their family. So you want to be able to battle that misinformation and make sure that there's good information out there. There's some examples that have taken place in some of these communities in a project that's called EBODAC. And this one I put up here because I think it provides some good lessons about what you can do. In this particular example, it took from Ebola. And some of the things that they really spent time on, I think are important to keep in mind, that taking the time to really understand people and where they are and what are the things that are important to them is really crucial. Like going through journey mapping or other types of approaches that you're going to just understand what's happening in somebody's day-to-day life. Like, why do they hold the opinions that they hold, or some of the challenges that they might have? Because that helps them building trust. When you understand the community, you're able to engage them more. Now, this particular project is looking at clinical trials, which is one area where there's a lot of distrust of the groups that are running the trials. So inviting them in to understand what you're actually doing and why you're doing it, and taking the time to listen, can really make a difference. The other thing to remember is that information travels differently in different places. So one of the things that we see a lot in low and middle income countries is use of WhatsApp. Now, WhatsApp is challenging because, well, it's digital, so it can go places very, very quickly, but it's also closed groups. So you need to be invited into a WhatsApp group to be able to have conversations. So having people on the ground and being able to address those things becomes really important. But there's other ways that people hear information. And over on the left-hand side, this is a picture of somebody that's listening to radio recordings, because a lot of people in low and middle income countries will rely on radio for their information, and being able to track some of the conversations, whether they're positive, negative, or neutral, can be really crucial. And trust in UN agencies is generally high, but it's also a concern amongst some. So you do really have to consider who is the messenger. So in some countries, simply sending out messages from WHO or UNICEF may reinforce some of the negative perceptions. So getting a sense of what the degree of trust from certain messengers is also important. So taking the time to analyze these messages can also help you in fighting hesitancy. So some of the strategies that you might do is simply just mapping out, whether people are issuing positive messages or negative messages, or they're simply neutral. But that process of gathering data is really, really crucial. And then the other thing that helps with hesitancy quite a bit is doing some stakeholder mapping and understanding where you're going to put your efforts. So in particular, understanding, is some of the hesitancy emanating from particular groups? This is an example in Pakistan, where there were religious objections to various vaccines. And so the strategies become, well, let's work with some of the imams, or let's work with some of the religious leaders in a particular area to help convince their population and have conversations in ways that are important. What we often see in some of the Muslim countries is that there's concerns about whether a vaccine is halal or allowed, whether it has the right ingredients. And sometimes engaging a religious leader can help mitigate some of those concerns and allow vaccination to move forward, because people follow their leaders. Or at schools, simply engaging in getting people together and having conversations about why people are hesitant can help lead to completely different outcomes. Religion, as I mentioned, does become really important in vaccine acceptance, and particularly in Muslim countries. So understanding what the degree of hesitancy, and this is a survey that was done in Indonesia, taking a look at different religions, so you can understand where you are and monitor the pulse in the community, because if you know that there's pockets of hesitancy, that's where you're going to put your efforts and start to engage. So in terms of what's next, confidence really needs to be maintained for vaccines as a priority. And when I say vaccines, I think it's important to put them in the context of broader health concerns, because vaccines are just one strategy to be able to prevent disease, but they are often a platform into other services. So children that receive vaccines are often more healthy because they're also receiving other services or having good practices in their family because they're more educated about their health. Misinformation needs to be addressed in multiple ways, and it needs to be not a knee-jerk reaction, because misinformation or disinformation happens at different levels. So sometimes it's something that is ignored, and sometimes there are specific strategies that you want to do to be able to address that information, particularly on a one-on-one level. Addressing barriers needs to include strategies for community engagement, and I can't emphasize this enough. Community engagement takes a lot of time, but it's worth the effort in the long run, and it's just really crucial to get an understanding, because there are no simple solutions to addressing hesitancy, because people come from different perspectives. And it's something that they just don't want to hear those pat answers that vaccines are good. That often turns a hesitant person off. We want to make sure that information is coming from trusted sources and that is understandable. Also addresses the program issues, because again, if you're answering questions about vaccine safety, but the real problem is a concern that you can't even get the vaccine, that turns people off. And we want people to have confidence in the system and want to go to the system. And we want to build capacity in local partners. So with COVID-19, it has also brought out new things that we need to start addressing. So in low and middle income countries, we're often thinking simply about children, but we do also need to think about adults. So I've just put some additional resources up here that if you want to address some of the questions about vaccine hesitancy or vaccine sources confidence, there's some sources here that I found very helpful. So that's all I have. I think we can turn it over to questions.
At the beginning of your presentation, you mentioned the amount of children that die each year from vaccine preventable diseases. Can you tell us that number again?
So there's 2 to 3 million children that die every year from a vaccine preventable disease. And with the vaccines that we have today, that's almost unacceptable. So the thought is there's about, over WHO's estimates are like we could probably prevent at least half of those.
Are there also barriers in terms of high-level government policies or local government policies around vaccination and healthcare?
Absolutely. So again, it depends. It depends what vaccine you're talking about. Whether you're talking about routine immunization, some of the barriers and policies might be that they might not see the cost effectiveness or the benefits of some of those. Sometimes they have poor data, so that could influence whether a vaccine is available. And in some cases, those policies might be around allocations. So things like COVID-19 that people don't have agreement with, who gets the vaccines first. So things like that.
And I think you did touch on this a little bit with respect to having trusted leaders in a community, whether that's a religious leader or a political figure. What is the evidence base for that being an effective way to make a difference for those who are hesitant to receive the vaccine?
So there's two parts to that question that I would actually talk about. One is using trusted leaders, and does it work? So I think we see across the board that trusted leaders become very, very important. And when we do surveys, we ask about trust often, and trust in swaying opinions. So having that trusted leader is really important. But the other part is, figuring out who is trusted. So it's one thing for us to figure out, to say that, you should be working with, pastors or imams, or, maybe it's the local expert from a university, but that's going to vary substantially from community to community. So this is where community comes in and becomes really important, to be able to map out who is trusted and get a pulse on what's really happening. So you're putting the right person, with the right audience or right organization. So knowing things I mentioned before, that, oftentimes WHO and UNICEF are a really trusted source. Well, when it comes to highly hesitant people, they may be just the source that people don't trust. So knowing that and really doing your homework and mapping out your stakeholders can become really important, because there's probably other people that are trusted. And sometimes communication is very indirect. They trust somebody. So a family may trust, a religious leader, who may then have a relationship with somebody in the healthcare system that they trust, but it's them, the religious leader, that's communicating.
So in this presentation, we've been talking a lot about populations in low and middle income countries. I guess just for clarity, do you believe that all this information and all these concepts would also translate to low and moderate income Americans, or
I love that.
other communities in higher income countries?
I love that question. So, and the answer is yes, because the concepts that I'm talking about actually apply anywhere. Now, of course, there's specific things that you need to take into account for a low and middle income country, like, they might not have the same level of internet access, or maybe use different types of social media platforms that we might use in the US, or have different people that they trust. But the concepts of engaging community, really understanding where people are coming from, are the same no matter where you go.
So as a professional, an expert with vaccines, what would you want those who are hesitant about the vaccine to know? I'm going to make the assumption that this is about the COVID vaccine.
Yeah, so that's a really good question. And first and foremost, I think we need to be communicating with people and providing information that they want to hear. So when we communicate, we need to be careful that we're not just pushing information out there and saying, here, you should trust vaccines, they're safe, effective, et cetera. We have to be transparent about what we know and what we don't know. And that becomes tricky in certain situations, because you have to run that balance of, you don't want to provide people with so much information that you're scaring them. But you want to be transparent about, we don't know everything yet, and that our expectations at this time are that we'll be able to control disease, or based on what we know today, here's what I would say about the vaccine, that we have a really terrible disease out there, and we know that the vaccine works. So if more people get the vaccine, we'll be able to get in front of the disease and start to control it. But it's going to take a while, and setting expectations is really, really crucial.
Absolutely.
And the other thing that you also want to do is you want to give people confidence that you're monitoring the vaccine. So it's not that you're just putting it out there, but that you're going to be watching it, and things will change over time as we learn more information, but that you would provide more information at a later time.
So also related to the COVID vaccine, I guess people are very interested in this right now.
Not surprising.
As an expert in vaccination, do you believe that we will reach a COVID vaccination threshold in the US at which normal life activities will resume in the next year? And do you think that LMICs will reach this same threshold?
That's a really good question, and I can't say that I have the crystal ball to be able to say that, to answer that. But that being said, I think there's some considerations that we need to be able to keep in mind. First is in the US, so there's different situations in the US as well as low and middle income countries. And I think one of the biggest challenges in the LMICs is that there simply isn't enough vaccine yet. So being able to get the vaccine to where it needs to go and be able to get it to adults is going to be a challenge for many countries. So I think it is going to be a challenge, but we've stood up to challenges before. So that's the good news. And I think people are motivated to be able to make things happen. Going back to the US, there will eventually be enough supply. My concern is actually about the demand side. And from what we're seeing, there's about 30% of the population that has some degree of hesitancy or is really unsure about whether they get the vaccine or not. And what really doesn't matter is that we get the vaccine, on average 70%. What really matters, what's really important, is that we get it within every single community. So our ability to be able to address hesitancy within specific communities is going to impact how long this disease stays around, and how effective we're going to be in our strategies to do that. So while I think we'll get back to some degree of normalcy, I think that it's going to be a challenge for a while, and our timelines may need to be a little bit longer.
It looks like we have just time for one more question, maybe two.
Okay, go for it.
So we have a question here about different ways of addressing vaccine hesitancy. And I think kind of the core of this question seems to be, is scare tactics an effective mechanism for getting people to actually take the vaccine?
So this is actually, this is a really great question. And so scare tactics do work in some places. I'm actually not a fan of scare tactics. And the other thing about scare tactics is you need to think about, am I accomplishing something for the short term versus the longer term? So rather than scare tactics, you want people to be realistic about what problem they're facing. So you don't want to sugarcoat the disease. You do want to talk about how scary the disease is and the promise of the vaccines. But you also don't want to paint a picture that's going to put you in a later spot of saying, well, you promised me that, if I get the vaccine, this is going to be solved. We know that that might not happen, or that it might not happen to people's expectations. So we do need to be careful with how we position vaccines and the importance of vaccination, and think about how we're doing it for the long run. So what we really want to do is we want to build people's knowledge. so they're equipped to be able to answer the questions that they need to answer about, should I get vaccinated?
Well, I think, yeah, that is all the time that we have for today. That hour went by very quickly.
And great questions. I love them. So
Yeah. So thank you for agreeing to give us this talk today and for answering our questions.
it's been a real pleasure to be able to talk to you all. It's something that I feel really passionate about, is making sure that people have a good understanding of vaccines, what vaccines do. Even explaining how a vaccine works can be really important to be building confidence, so people know that they have the power within themselves to do something that's going to protect disease, and hopefully talk to others and help convince their own communities that there is a collective responsibility to make sure that everybody's protected.
All right. Well, thank you again, and everybody have a good day.